Hello, everybody. Sorry, had some technical difficulties, and I think we're up and running now. Um, I can't stop coughing, so I'm sorry we're a little late. Tonight's Empower half hour is about social skills, rethinking social skills, supporting connections for neurodivergent and autistic individuals. Um, I'm sorry, I'm a little distracted. My phone is blowing up, and I'm going to put it on Do Not Disturb. Okay. Um, so I have some pretty strong feelings about social skills and social skills groups for autistic and other neurodivergent individuals. I will preface what I'm going to say by first stating that I am a speech language pathologist. I have been working in a special education school setting for 24 years. I have a lot of experience with um, working with autistic individuals, ADHD individuals, learning disabled. I mean, pretty much the gamut from since 2001. I have seen and hosted and ran many different social skills groups, and things have significantly changed from how they used to be held and ran to how I feel about how they are run and set up today. So when I ran some social skills groups this summer, and a lot of parents, and I had to, so I ran some social skills groups this summer. The ages were 4 to 6 and 7 to 12. I will have to say that it was very difficult. I had parents stay. I did not vet or uh, interview parents or children before they came. I advertised them as neurodiversity affirming social skills groups, which was is difficult to advertise in that manner because a lot of parents, a lot of individuals, a lot of people don't understand what neurodiversity affirming needs means. A lot of parents still continue to email me and message me that they're looking for social skills groups for their children. Um, they are they want that connection for their children. They want for them to be let's say exposed to social skills, interacting with other children, um, and I'm sorry. Can you hold on 1 second? My son is losing his mind. Okay, so um, I'm very sorry. So yes, exposure to social skills. So my thoughts on social skills and exposure to social skills is that um, I'm sorry, I'm very distracted. That I'm gonna have to edit this. Children who are autistic or neurodivergent really need to have a foundation of specific skills or certain skills or understanding or the ability to be in a group or within a group or in a group that is run by somebody who is very play based, kind of has boundaries, but lets the group kind of morph into what it is going to be. Now, there are very many different social skills groups out there. Some are play based, some are very, some parents want a very, strict, like I want them to have conversational exchanges. I want them to make eye contact. I want them to answer a question. I want to be able to have a conversation with my child. Some are theater based, which is very expressive and creative. Um, so depending on what you are looking for, there is a lot out there. Um, but I do think that children need to be able to be in a room with other people, whether they're interacting or not, especially for our autistic children. Um, Even if they're in a room with, say, three or four other people, me personally, as a speech language pathologist, I wouldn't make them sit at a table, depending on age, depending on ability, depending on support need. To generalize, a social skills group, and I've seen them, run in the building that I work in. Um, you know, at this point in my career, I'm not going to force a child to have a conversation with somebody else. We're going to kind of see how the flow of the meeting goes, of the group goes. Have children bring in their special interests, and amazingly enough, children with autism, when they are around and grouped with other children with autism, they tend to be drawn to those people, to each other. I've seen in different places, it's called AUDAR, kind of like radar, but autism radar. They're just drawn to and know and can pick out other individuals who are also autistic. When you start to add in children with ADHD or other learning disabilities and typically developing children, social skills group can become very cumbersome. It's very difficult, especially if you get into numbers of, not age yet, but rather just solely numbers of children within a group. I think a group of four or more children, if you're really focusing on social skills, is probably the max that I would put children, in a group. I know a lot of the mandates in school are groups of five or more. I think that is unmanageable and unrealistic. I think social skills, you want to, before you even get to a social skills group or a social group, any type of a group with a child, of three or more children, I think you need a lot of individual services or a lot of individual, back ending of skills before you put them into that group, even if it's a smaller group. Now, I know many of you are thinking, but they're in a classroom and that's a group and there are so many kids in there. And um, it is a group, but it's not specifically, it's a large group and the teacher is directing the group, the class. And the children really don't have to, I guess, engage with each other directly. The individualized services or individualized therapy, or I guess therapy for a lack of something else. Uh, Individualized services will help your child to either understand neurotypical development, understand neurotypical nuances like facial expressions, body language, tone of voice, um, play skills. And this is all depending on age. So if you have a younger child, say age three to five, even 3 to 10, a lot of those individualized, individual sessions are going to focus on play skills. You're going to do a lot of, you're going to have a lot of modeling of language, um, talking about things, explaining things, describing things, items, what you're doing, explaining what you're doing as you're doing it. You don't really want to prompt with, like, look at me or answer this question or what are you doing, kind of, lead, follow their lead. As you get older, 10 and older, and if a child is more conversational, maybe they're scripting, maybe they're not conversational as we know, like this back and forth, um, as typically developing children are. Autistic children script a lot. So their engagement with other people is going to look a lot different than it looks like if you or I or me and a typically developing child would look like. I'm if you're so to begin a social skills group, I think that, or to target social skills, I think that the children need to be, um, seen individually and work on a lot of foundational skills, a lot of, prerequisite skills. Being able to be in a room with other children, understanding their regulatory needs, they're understanding or having the ability to advocate for what they need or what they want, or when something is too much and they need to leave a situation or they need a break, whether it is communicating on their device or with mouth words or sign language, whatever mode of communication that they're using. um, I'll go back to my experience with the social skills group this summer. It was challenging because I had the parents stay, which I thought would be great, because my big passion is to educate parents. I think that having either social skills groups or regular groups or individual sessions, having a half hour with me twice a week or an hour with me twice a week is really not going to make or break a child. I think parent involvement is a very large piece of supporting our children. And if there isn't parent involvement and there isn't carryover, and things aren't being brought into the home and practiced at home and modeled at home, then I think a lot of our children are going to possibly, struggle longer than they need to or they should. Excuse me. But I will say that I think that social skills groups, my response to parents who are, emailing me and messaging me about group social skills, I typically respond to them, let's set up a consult, let's see where your child is at, let's see what skills they currently have, what can we target individually before we expose them or throw them right into a group focusing on skills that they may or may not be able to they either they do or they don't have, or it's being taught in a way that is not affirming to them. Because autistic kids, we're not going to focus on eye contact. We're not going to say, look at me. We're not going to focus on how many turns they can take. I say something to you, you say something to me, I say something back. I see those goals all the time on IEPs. And it's so frustrating because an autistic individual or neurodivergent child is going to have a conversation in a much different format than, you know, tallying, turn taking for a goal. It's going to be much more naturalistic. It's going to be very play based and strength based. We're going to talk about number blocks, and I'm going to jump in on their what they're talking about, or their gestalts or scripts, and try to connect with them and engage with them about what they are interested in. And if you're lucky enough, or if the school is lucky enough, or as a parent you're lucky enough to find even just one other child, and I'm going to say, may not be a big fan of this, but I'm going to say that age really doesn't matter, because I have 6-year-olds who can have amazing conversations with 8, 9, 10-year-olds, because say they're all watching Poppy Playtime. 6-year-olds and 8-year-olds, 10-year-olds, 12-year-olds, they're all watching Poppy Playtime. And you would think, well, I can't group these kids together because look at the age difference, look at the grade difference. But when you're supporting neurodivergent children, sometimes that age difference doesn't matter. I mean, if you're, you have to watch language, you have to watch, bad language, and, some of the older kids, have a more robust language. But if you just take it as, we're going to talk about Poppy's Playtime, and you're talking about the characters and what they do and how they look and what they look like, the connection and the social skills that come out of that connection are amazing. And I've had students in the past where you would never think to put these students in a group together. And then all of a sudden you're like, well, this child, she loves poppy playtime, and he loves poppy playtime. And yes, there's a 3 or 4 year gap between them. And if I pull them and just put them into a group together, they will have a better conversation and connection and interaction with each other than if I'm pulling, the girl who likes poppy playtime and the boy that's the same age as her who loves number blocks. They're not going to connect. It's going to be frustrating for both of them and for me, because now I'm trying to get her to like what he likes and him to be able to explain something that she's really not interested in, and it really doesn't work. So the creation and the mindset, I understand the mindset of a social skills group. We want to have our kids be able to connect. If you're signing your child up for a play group at like a sensory gym or a library program, just to have exposure to different experiences and different people, and different places, I think that is absolutely wonderful. But I think we get into a lot of the double empathy. A lot of people don't understand the characteristics of neurodivergent children or autistic children. They're learning language differently, they're processing language differently, they're using language differently, they're stimming, they have different regulation needs. And I think society as a whole has a lot of difficulty with that. And I think as parents and educators, we have um, a large need to educate other people, especially neurotypical people, to help them better understand what neurodiversity is, how an autistic child or individual interacts with other people. Um, so I think that yes, I would definitely sign your child up for all the things. Join school activities, join the SEPTA, go to the groups. um, I think that when you're looking for a social skills group specifically, kind of dig deep in your own for your own idea of what you are trying to target in those groups. I would ask the question of, ask whoever is holding the group, like, what are you targeting? Are you making the kids sit down and we're going to work on eye contact and conversational exchanges and manners and uh, body language? Or is it going to kind of be a little bit laid back and let the children lead the group? And is the provider interviewing or consulting with the parents and the children beforehand, to try to form a group of children who, what, everybody loves Legos, and this is going to be our Lego socialization, social skills group based on Legos special interest for ages, 4 to 10. And, 4 to 10 might seem, four is a little young, maybe 5 to 10. But if you get those children together in the same room, um, they will the I can't explain it to you. The connection and the social interaction that they have is amazing. It actually gives me the chills. Have you ever seen any public school special education programs host social skills groups outside of the classroom? Yes, I will say yes. Where I work, they have social skills groups that are run by the counselors. Um, I sat on uh, a few of them, and they are run, I would say, more neurotypically. They might be changing a little bit, but within the schools, it's hard. This is my kind of platform, trying to educate professionals and parents, on the different ways that autistic children need to have their social skills supported. So yes, you can have social skills added to your child's IEP. It typically looks, from my experience, it looks like counseling service. They will add to group counseling, um, or a group counseling, and they will usually run it that way. I know that I have groups, they're just called speech groups. They're not specifically called social skills groups, but we do target, sorry, my cat's being a pain. We do target social skills, but not in the way, and I do not write goals that are conversational turn taking. I do not write eye contact goals. Um, you know, it's more of the understanding and awareness. Self advocacy goals are huge. Self advocacy at any age, I teach children to say no. I support children in, when they're telling me, I don't want to do this, I'm not ready yet, I don't want to get off, or I don't want to stop playing whatever we're playing. That is a child advocating for what they want and what they need. Sometimes as adults, as educators, as parents, we are just like, no, you have to do it now. But sometimes when you have the ability to wait and wait them out, and let them advocate for themselves in that manner, it's good for them to be able to say no, or say I'm not ready yet, or say I need one more minute. And in those moments, we can teach them and support them to say, more appropriate things, as of course age appropriately, as they get older. You have a 4-year old and they're just going to say no. So you're going to model the language. No, I need one more minute, or can I have some more time, or whatever it is. Of course, you're going to use timers, or, first then, all right, let's first do this. And then, in 2 minutes, when this is done, then we're going to move on to this. And there are a lot of different strategies you can use with that. Sorry. Everybody in my house is crazy today. The kids, the cats, I don't know what is happening. Is it a full moon? Um, so I do think that social skills are very important for neurodivergent and autistic children. I just think that again, my perspective, my experience, what my passion is that autistic and Mercury and retrograde. Yeah, something is happening. I'm not liking it. I'm very distracted. It's driving me. It's throwing me off my game. I don't like it. Uh, it is important, but the way that we're approaching social skills needs to be adjusted. We need to really focus on the children's strengths. We need to focus on grouping children together based on their special interests, not really focusing so much on age, because like I said before, even you can have a 12-year-old and a 16-year-old and they really love Rubik's cubes, and you put 3 12-year-olds and 2 16-year-olds in a group and they're talking about Rubik's cubes, and you're going to see so much language, so much connection, so much conversation. Does it look like back and forth conversation like typical children might have? Probably not. They're going to info dump. They're going to, not wait to take a turn. They're going to overtalk each other. And in the initial stages of that group or any group, you're going to let that happen. See, observe. A lot more observing needs to happen. Observe how the social skills, how they're interacting, what they're saying to each other, how they're collaborating with each other. And then after a few days or weeks of observing the group in action, then you're going to start to model different things. Okay, maybe when Jimmy is talking, we're all going to pause and wait a minute and let him finish talking before we add what we want to say, so we can respect what he is saying. Again, all of this, it's hard for me to talk about the age ranges in a as a generality, because it's going to be different for every age range. Um, so you're going to observe the group. If you want to put your children in a social skills group, um, you want to see if the provider or whoever is running it, first I would think that you would want to make sure that they are, licensed. You would want to vet them. You want to see what their background is, what their experience is, um, lived experience, work experience, what licensure they have, what certifications that they have, how many groups have they run, what is their perspective on running groups, and it has to match with your family's values. I talk about that almost in all my lives and all of everything that I do. It's a very important that any provider, advocate, lawyer, therapist, whoever it is that you're having your children interact with, make sure that they are aligned with your family's values. And you always have the right to say no. This isn't a good fit, and we're going to move on. And that's what you need to do for your family. So yes, vet the people, ask how they're interacting. Again, for the youngers, it's going to be more play, and they might play on their own individually, but never think that they're not listening and they're not hearing and they're not paying attention. Because a lot of times you hear, well, oh, they're just over in the corner playing by themselves. I will tell you, probably 90% of the time, they may be playing over there in their corner by themselves, but they are aware of everything that is happening in that room. They know who is there, they know what they're doing, they know what they're playing with, and you'd be surprised if you have four children in a room and they're all playing with different things at some point in time. And this even happened during my social skills groups this summer. I had a very diverse group of children in my groups. Um, non-speaking children, ADHD children, autistic children, um, and some of the children wouldn't be part of the group, and it was very play based and activity based and art based movement. But then out of nowhere, after it was a 6-7 week program and you get into week 3, and then that child who's over there playing by himself, who you think is not really paying attention, is now putting himself in the group, and he's trying to interact, and he's trying to play with the other kids. And it's a lot of sitting and waiting and being comfortable in the not over talking and over modeling and not over asking questions of, oh, play with them, and now it's your turn, and now it's his turn. And we really want to kind of get away from that. And you know what, Johnny's playing with that toy right now. He's not ready to share. We're going to let him finish playing with that, because then that's not fair to Johnny. If we're, oh, you have to share, like, why? Let Johnny finish playing with the toy. And then now we're learning waiting. So now we have to learn to wait and respecting other children while they're playing with their toy. And then, or you can play together. Oh, Johnny, is it okay if Sam comes and plays with you? Maybe we can all play together. Look, here's something else that looks, that you could play with next to him, while you're waiting. And there's so many things you can target, and so many different angles of, exploring social skills. Um, I would love to be able to have more groups, or any groups, in my setting. And unfortunately, where I'm currently located, it doesn't look like that's really going to pan out. Um, so I can, so I have to be a little bit creative and see how I can do that, because I do have a lot of parents asking for social skills groups, and I'd like to run them the way that I think would be most supportive for children, based on their special interests, and not really focusing on neurotypical skills. Again, based on age, as you get older, you can focus more on neurotypical skills, but more of the creating awareness around neurotypical people. Neurotypical people are going to make facial expressions, they're going to use body language, they're going to use a lot of figurative language, which autistic and a lot of neurodivergent children, or teens, adults don't understand. They like to be blunt and straightforward and say what they mean and mean what they say, and they really don't beat around the bush. So we have to kind of support them in understanding that neurotypical people, sometimes they don't say what they mean and they don't mean what they say, and you kind of have to read between the lines, and a lot of neurodivergent children have difficulty with that. um, and then then you get into, I'm going over the 30 minutes a little bit, but then you get into masking. Then you have a lot of children who learn how to mask, which then takes a toll on their mental health because they're trying to be somebody they're not, to fit in and please the other children, the other adults, the school setting, whatever it may be. And that's where a lot of the work falls on the adults. We need to do a better job of, it goes both ways. Neurotypical adults and children have to be more understanding of the neurodiverse population and how they learn and process and their needs. And they need to info dump sometimes, and they're going to give you a 20-minute you know informational novel about dinosaurs or space or number blocks or ocean animals. And you know what, being a neurotypical individual, I understand that, and I'm going to let them info dump. But our children need to learn that too. And like, oh, all he wants to talk about all the time is dinosaurs. Well, yeah, that's his special interest. Why don't you ask him questions about that? And and he'll be more than happy to share that information. And then the adults will support that child who loves dinosaurs and saying, you know what, sometimes we need to pause. Sometimes we need to let somebody else have a turn, because neurotypical children don't want to, or, a lot of children don't want to sit there and just listen about dinosaurs. So it's important to let everybody have part of that conversation. I feel like this conversation about social skills can go in so many different directions and can be so much longer than a half hour. And I had a little bit of a rough start with everybody on my end. But I will try to put more things, because I do try to write a blog after the lives that I post here. And the blogs are on my website. So I'll work on that tonight and have it more structured and organized. But I do think that social skills as a whole, see you tomorrow, and are very important. I just think they need to be addressed in a different manner. They need to be supported in a different way. And I think what parents are looking for in a social skills group might not be exactly what their neurodivergent or autistic child really will benefit from. Please ask questions in the comments. I kind of rambled and was thrown off. I really apologize. The more questions you ask, it helps me to kind of structure my brain and see what parents are really looking for and really need. It does help a lot, because I do have a lot of information to give, but I have a hard time knowing where parents are at, or really what they want and what support they need, or what information they want. I have a lot of information kind of from the inside out, being in the school system, in the specifically in the special education setting, and now having my own private practice. It gives me a little bit more leverage to share my knowledge from the inside out, and then being on the outside in. And what parents can ask for, what you can have in an IEP, what social skills in a school setting should look like, what it should look like outside of school. You know Education and continuing education that you can ask to be put on the IEP, based on your neurodivergent child, that you want the support staff in the school to be knowledgeable about. It's another great Facebook Live that we can do, is support needs and IEPs. But I hope everybody had a happy Thanksgiving. A few more weeks to go until we get to Christmas break, a whole 2 weeks off. And I will look forward to talking to everybody next week, and have a good week. Please ask questions. Take care.